I've just put this in briefly. This is a slide I made for our fetal medics a couple of years ago, just to sort of summarise the other R numbers that are relevant for fetal medicine. And the one I just wanted to highlight here, so obviously you perhaps have heard of the R21, which is the fetal panel that we do in cases of fetal anomaly where we're trying to get a result for people to make a decision during pregnancy. And they're the ones where we might get a diagnosis, so we already know a diagnosis and we don't need to therefore do a post-mortem, for example. That's a rapid test and turnaround 2 to 3 weeks. The other one is an R14 test. So if a couple presents to us, and this is one that is relevant, I think, in this situation. So if a couple have lost a baby, we think there's something on, they've had a post-mortem, we're suspicious, and maybe they've been referred to us or they're still waiting for the post-mortem report, but then they become pregnant while they're waiting for that to happen. If they then get referred to us, we can then do a rapid test in that situation on that previous fetus, if they would act on the information. So if they come along and say they're really worried and they would have a prenatal test, then we could do what's called an R14, which is a really detailed, really rapid test that can go on in about 2 to 3 weeks. We do it a lot in neonates and on the paediatric intensive care unit, but it's also relevant in this situation if there's somebody who's pregnant and they've lost a fetus previously. Someone's just said, is an R14 better than R21? So the answer to that is yes, but you can't use it in the same situation. So an R14 is only used for fetuses that have previously been lost in the pregnancy situation. You cannot do an R14 gene agnostic on a current pregnancy. The test that you do in that situation is an R21, which is a fetal panel, about 1,000 genes.